โดยขึ้นละอังกฤษกับเกาหลีบ่เป็นหยังแต่ว่าน้องก็บอกให้คนเข้าใจว่าภาษาเกาหลีเป็นภาษาลาวแล้วก็แล้วอันโดยน้องเว้าออกไมค์เลยก็ได้เพราะว่าตอนนี้คันอ้ายเว้าแล้วก็จะบ่ได้เลือกซ่องหั้นนะมันก็บ่นั่นคือเก่า So, good morning, everyone. Before we can start our presentation, I would like to ask Dr. Ponsavankanakan, the head of the Nutrition Center, to give us the opening remark for this presentation today. Good morning, everyone. For those who want to use the interpretation function, may I explain that the Lao language is actually a Korean button. So if you want to listen to Lao, please select Korean button. First of all, thank you, Dr. Kitti Sranacharoenpong, for taking the role of the speaker for today's session. And thank you all distinguished participants who are joining us today. Actually, we invited many distinguished participants from relevant departments and agencies joining us today. So on behalf of the head of the Nutrition Center, I am very pleased to be able to welcome everyone to our monthly workshop under the theme of the Thailand School Lunch Meal Program, which received great success. And today, Dr. Kitti Sranacharoenpong took his time from his busy schedule to join us today to share those experiences with us working in multiple provinces in Thailand to improve the nutrition status of students in school and improve the not just the quantity of food, but also the quality of the food provided to students, which enables students to have better learning outcome. And so, of course, if we can improve the nutrition status of children, then they can learn better and the effects can be cascading toward other areas of their life. In today's workshop, we would be able to learn of this great experience from Dr. Kitti. And of course, we would have the Q&A session for everyone who wants to ask Dr. Kitti about his experiences in Thailand. And of course, the website is also available. So you can access information to gather any information that you might want to learn deeper. And it is my hope that today we can learn from our colleagues in Thailand and apply that to Lao PDR and to achieve great success as well. Finally, I would like to wish everyone great health, great success. And on that note, I would like to declare the official opening of this meeting from this moment on. Thank you. And now I would like to pass the floor to Dr. Kitti Sranacharoenpong. Thank you, Dr. Ponsavan. Allow me to take a few moments to share my screen. And thank you to Lao PDR as well for inviting me to share our school lunch program. And the topic of today is, as mentioned earlier, this is the Thai school lunch program, which I want to share with you, and how can we incorporate this into our system and make them sustainable. And you would see there are many factors in play in this process. And this is some of my background. I am a nutritionist. I graduate in undergraduate and master at Mahidol University, and I then continue my education in the US. And then after that, I worked for more than 25 years as nutritionist. And in 2013, in order to increase the research and the studies, I have worked with some of the agencies to deepen my research on nutrition. And at the moment, I am working on maternal and child and sustainable diet, which will be related with the climate changes, which I focus on carbon footprint and the food chain system from different countries. We also have clinical study of nutrients at hospital. And one more thing that I'm also doing is non-communicable disease prevention and health promotion. And in these 4 areas, we also have some researches that we are still doing for more than 10 years. Let me first explain why I need to explain about school lunch meal program, because it serves to address the SDG number 1 and number 2, which is number 2, on zero hunger. And if they can eat better, then they can improve their learning outcome. And working on this will solve many of the SDG problem. And I understand that the result will not show itself within 1 or 2 years. It might take 10 years. But what we invest in will not go in vain. We would see the benefits in the future. So this program, the objective of this program, when you look at this from the background side of this program, and as you can see on the screen, the majority of the children will stay at school, and we can train them during their time at school and to instill good behaviors for them. If only the environment at the school is conducive enough for them to have good behavior. And in terms of balanced nutrition, it is something that can be taught at school. You can teach about nutrition to students during their school hours. And I believe that providing lunch at school, it can help us address the undernutrition and overnutrition at school. Because in Thailand, we are not only facing with undernutrition, we are also having overnutrition. And this is something that it is very important for us, because children spend 8 hours a day or more at school, and we should not expect them to learn about nutrition through one subject, which is health related subject. We can incorporate nutrition in everything that they learn, for example, mathematics or English. And I am proposing that we add nutrition element into different subjects to the Ministry of Education. And one more thing, for high income countries, this SFP aim to tackle the rising level of overweight children and obesity in children, especially in countries like the US. But for middle and low income countries, in the past and even in Thailand, we wanted to address the undernutrition in Thailand. Maybe in Thailand, 50 years ago, we had a problem of the low intake of protein and some minerals such as iodine, iron. And you can still see some of this problem nowadays, but the lack of micronutrient in children can be seen less now, but in the future, we want to improve the nutritional status of children. And one more thing that is important when we have SFP is that we want to improve their school attendance. And having SFP, it will encourage the parents to bring their children to school every day, because at least they have one meal for their children provided at school. So nowadays, all Thai children will now have receive lunch and milk at least 200 days per year, per school year, and that cannot be cut out of the budget. And since we have the system laid out, we have to improve this even more each year. And also in the longer term, we are aiming to improve the cognitive development, and especially this when you compare to other countries in Asia, this is an area that we need to improve now, and especially nowadays that we know that it is very difficult for children to focus more due to the access to digital devices. So it is very important for parents to educate their children the importance of developing their cognitive function and how to control the use of digital devices. Otherwise, it would impair the function of the cognitive function and their brain. But for us, the nutritional status is not a big problem anymore. It is not very difficult to address. But for us nowadays, it is the treatment of cognitive development. Especially we are in the area where social network is a major part of children's life. And this is a picture of Thailand in the past for cases of undernutrition or malnutrition of iron and vitamin A, especially children in the north of Thailand. For example, in Chiang Mai, where I used to work, they have this kind of symptom. Even have one case can be considered as a major health issue. And for the lack of iron can be found a lot in the northeastern part of Thailand. And this can be due to that genetic outcome or due to their behavior. And this problem can be addressed more from the problem that accumulate for more than 50 years. Now, for the overweight, we have more than 7.6 and obesity 9%, which Dr. Ladda from the South did this research, and we can see that Thai children had even higher probability of gaining weight or become obese. And in the future, they have higher likelihood to become sick adults, for example, diabetes and other diseases, and that would reduce their mortality and their life expectancy to just 60 to 70 years old, and the majority of this time of their life, their age would be used to treat all of these long-term diseases. So one thing that we can do to address this is to tackle their eating behavior from school lunch program. And through this program, we can also provide information to them. The faster we provide the information to them, then the faster they can address this issue. And this can become the change agent. Even children, when they were very young, and they're not speaking, they can convey messages to the parents. For example, I don't want to eat these sweets or sweetened drinks, and that can be something that change the behavior of the other family members. Now, for the school feeding program in Thailand, our target group are children aged 3 to 12 years old in public school. So all of these children at public school will receive the lunch receive lunch and milk. The school lunch meal program in Thailand started in the 1950s and the school meal program in 1992. I wasn't born in the 1950s, but I knew that the school lunch program started back then, but it didn't start nationwide. It only started for those who did not have lunch. And after that, we set up the school lunch fund, which was established under the Ministry of Education. So after we have the fund, we have more budget, and when the budget increased, we had more opportunities to provide lunch to other children in the country. And so this is the start of the school lunch program, and we have to thank a lot of senior management back then who think in advance, with the vision to improve this issue in the future. But of course, the program did not address all of the problems that we have on malnutrition, but we need to keep improving day by day. And now for the school meal program, we started in 1992, which in Thailand, we have to thank the former king who started this initiative to provide milk for all children at school. And because the aim is to provide enough milk to everyone in the country, and nowadays we have a supplier in each province to provide milk to all children at school. The purpose of the Thai SLP is to educate students about desirable eating habits, values, and social manners. And we also want to promote child growth and development. And the other objective for SLP, as I mentioned earlier, it is free of charge to everyone every day for 200 days per school year. And lastly, it is to promote the school garden program, which is to encourage the school to have activities or something that would help with the implementation of SLP. And it is still under the same objective. Now, all of these objectives that were established by the Ministry of Education for SLP would have the budget of all of these objectives that I just explained. Now, let's take a look at the components of healthy school lunch. From what we've learned so far, we have the budget, of course, as one component. We also have the stakeholders, which will include teachers, parents, cooks, PPP, and farmer, public-private partnership. And for infrastructure in Thailand, I just want to talk you a little bit about this background. Now that we have the budget, of course, for the school, we usually have the school buildings and other buildings, but usually we don't have the infrastructure for the canteen. So a lot of the school do not have the kitchen or the canteen. So we need the extra fund for this. And one important thing for nutritionists is that we have to have the standard, especially the standard related to the quality of meal and quantity of meal for students. This is something which I developed for Thai in 1999, which is my research papers in my master's during my master degree. So what we want to see happen is that this should be the food pyramid that is appropriate for children. And what the other component that I add here is the food environments, which will address the issue of overweight or obesity. So these are the components related to school lunch program, which will have its setting at schools. Now let's take a look at these components one by one. Now the first one is the budget. As I mentioned, we started this SLP in the 1950s. The first budget that we received is 5 baht per head, and this is to address the underweight children problem, and the teacher will do the first screening to find out which school has children who are underweight. And I believe that back then we don't have a lot of overweight issues. But most of the nutrition problem is underweight, and any underweight children will receive 5 baht. And then once we have more budget, we increase to 10 baht, and then this number also increase in terms of the day to 200 days. And then once we have more budget, the budget increased to 13 baht, which is 41 cents in US dollars, but which is basically nothing. You cannot buy anything with 41 cents. And in 2013, it jumped to 20 baht. And this 20 baht per head is an average budget. And in private school, they can use 20 baht or more, but they cannot go below 20 baht. And in Thailand, there would, we have different types of school, public and private school, or even school for monks, and they would all use these standards. The limit. It is 20 baht at least, and I don't know how this number was calculated, but I believe this is based on the budget and from the fund that they received back then. And so this is calculated so that the fund can still have enough budget to manage its operation. And at the moment, we have the new budget, which I was the one involved in the calculation of this, and which I will explain later. How can we make this budget sustainable as well? This is the new budget. As I explained, will be dependent on the size of the school. We will not give equally to all children. In the previous slide, we give equally, but for this one, it depends on the size of the children at the school. And when we provide the budget, we also think in terms of management as well. So the budget would be, we would provide about 1.1 US dollar to 0.76 US dollar per head per school. And this budget will cover ingredients, food service management, and which will include wages for the cook, gasolines, and etc. So this calculation is more systematic and more logical. So when we have to defend our decision with the minister's cabinet, then we have more scientific background or explanation to tell them. And now let's move on to the next component. Now that we have the budget, we don't want the school to use this budget as they wish. We need them to have the standard for providing lunch. And the institution that is involved in developing this standard is Mahidol University. So they determined that the nutrition of the student should come 20% from breakfast, 10% from morning snack, lunch 30%, and afternoon snack 10%, and dinner should comprise 30% of total energy needed. But now let's think of the children in poor family. They might not be able to have all of these source of energy in each period, each day. So at least if they can receive lunch and afternoon snack, then, it's 40% of their energy, So at least if they don't have meal in the morning or at night, they have 40% of their energy delivered at school. And the teachers were taught to observe if children had breakfast in the morning before they come to school. And so this SLP encourage parents to bring their children to school because of the incentive to have a meal for their children, and we were able to increase the enrollment to more than 600%. And now parents know automatically that if they bring their children to school, they would have at least one meal for their children. And a lot of questions we receive is that what happened during the school break. So during school break, we distribute meals to their parents so they can come to our school to pick up the milk for their children for that period. And we announce and we put a label on it that this milk cannot be sold. It is only for use, for consumption. But at the end of the day, there's no way to confirm whether the children themselves get to drink those milk or not during the school break. Now let's take a look at the food we provide to children nationwide. So when this is the plate, which has different field of space where we put different types of food, which comprise of carbohydrate, protein, and fat. And the staff at the canteen, they would not know this based on their traditional education upbringing. So this is also something that we need to educate the teachers, that we have to tell them that the school lunch should comprise or should give children 30% of their daily energy, and 10% should be coming from milk. And milk is also a good source of energy, protein, calcium, vitamin A, and vitamin B2. So all of these nutrition information is also on the side of the milk. And it is important to also tell the school that this milk should not be sweetened milk. This should be just normal whole milk, and all of these children should drink unsweetened milk. And this is also from our manual for school lunch program that I extract, but in the future, but before we comprehend it, we implement it, we have to explain to our teachers to understand that the total carbohydrate should be about 55 to 75% of total energy. Total fat should be 15 to 30, protein 10 to 15, and sugar should be less than 10, which I believe that the teachers will not understand this problem because they did not graduate from university in nutrition courses. They graduate from other courses, but they have the role of providing lunch to students. So at first it was very difficult because teachers did not understand. They might know how to cook, but we want them to have also nutrition knowledge. So this was something that the nutritionists had to work with teachers at school, because we have to work based on the manual, and the manual should be something that is comprehensible by the practitioners. And when we show this table to the teachers, it creates more confusion for them at first. You can see that the energy and nutrients are different for children in different age. For example, preschool, grade 1, grade 3, grade 4 to 6, you can see that the energy and nutrients intake would be different based on Thailand's RDA. And so the teacher will not understand this. And for example, energy 500 of 20 for preschool, 560 to G1 to G3, 660 to G4 and G6. How is that translated into rices? And in terms of, this is something for nutritionists to understand. This is the background for the nutritionists to follow. And these guidelines are used in Thailand. And calcium, and for example, this is 320. This is from one box of milk, but the rest is up to children, parent, to provide additional calcium. And because usually children would require about 600 to 1,000 milligram of calcium per day. So this is something that we do, and we provide, but we are not pushing this responsibility to just one side, either the government 100% or parents 100%, because everyone needs to be involved. And so we try to convert the metrics in the previous group, in the previous slide, into something that the teachers can comprehend. For example, carbohydrate, it would be rice, for example, it would be 1.5 rice spoon, or 2 to 3 rice spoons for grade 1 to grade 12, and meat and products also follow the same logics. So this is something that the teachers would understand. For example, calcium would be like 200 milliliters of milk. The fat and oil energy that you see in previous slide of, like, for example, 10 to 15%, that's like 1 teaspoon. And this is something that we need to teach teacher first. And the other component that is important is the stakeholders for the success of SLP. In Thailand, if it was only the Ministry of Education who was in charge, then back then we would not be so successful, because we had a lot of limitations. We would only be able to provide the budget per head per 200 days per school year based on the Thailand's food school lunch meal program foundation. So apart from the Ministry of Education, we also have different foundations who provide the assistance, but we had to screen them carefully whether their objective is really to help children. For example, in Thailand, we had the Ajinomoto Foundation who provide the support, but we carefully monitor to make sure that they are not using their products to provide the support. And apart from that, we also work with Mahidol University, who produce different guidelines and information for the school and for the teachers to follow using the guideline from the ministry. Because the reason that Ministry of Education worked with Mahidol University and Ajinomoto is that was because there were many components of this school lunch meal program where the Ministry of Education cannot work alone or cannot implement. So it was important for the ministry to work with different agencies, stakeholders, for example, Ajinomoto. But as I explained earlier, the company would not be allowed to use their product as part of this partnership to prevent them from having or gaining any benefits for the company through this operation. And the objectives of this project are to provide the school nutrition knowledge for staff and schools, and to help them, to support them in the long run. And why did we select the teachers to be part of the group of people to receive the nutritional knowledge? Because as I mentioned, the teachers do not have this knowledge. We have to train them first. Ministry of Education provide the budget, but we need somebody to use the tools or guidelines that were developed at school, because if we develop the tools and guidelines and nobody implement it or use it, then it would be useless. And the lunches are cooked by local people or local cooks in that area. So the people who are involved in this program need to be educated, and the funding support for the education came from the private sectors. So the foundation set the objective to donate about 200 million baht to around 200 primary schools. In Thailand, we have more than 20,000 primary school, which is, so 200 primary school is only 10%. So the training part was done by Mahidol University, and now we have the training online for 3 months, and after 3 months we would have on-site training, which we will meet at some site, and each year we have about 10 training for 10 schools, and each time we would have 50 participants, or that means 5 teachers per school. And for on-site training, we would include the head of school and the teacher responsible for lunch meal, and teacher responsible for students' health, and chefs from the village. There's also staff from MOE, especially from the provincial staff of the Ministry of Education. Initially, we wanted to, we think of ways to implement this program differently. So what we did in this program is we asked the head of school or the dean of the school to join, the director of the school to join this training, and they must come. And if they don't come, we will not give them 1 million baht of budget for that school. Mahidol University has the responsibility to provide a training for the cooks and the teachers. And it was difficult for Mahidol at first because they don't know what to train the teachers. So we need to develop the modules together. So we came up with 8 modules for teachers. But because the trainees are not students, these are adults. So we had to have different approach for these teachers. So we have, of course, the lectures, and we have some practical session, game, and problem-based learning and cooking class. We also have before and after tests. And what's important and different from this program to other program is that we have the follow-up after 6 months, 12 months, 8 months, and 24 months after they receive the training. So we would have the line group to monitor them, and then to monitor the outcome of these 200 schools. So this is rather a large-scale project, and the Ministry of Education also acknowledged this project and program because they received the budget of 200 million baht. This is a team from Mahidol University that we provide online training. We first started with e-learning course, and we are adapting the e-learning course because of the outbreak. And we could not meet each other on site. But the e-learning, there's no compulsory training. So because it was difficult to enforce everybody to come and sit together for 6 hours online, so they can take this course on their, during their leisure time or anytime they desire. But the important thing is they need to pass the examination that is mandatory. So before they can graduate from these courses. So we work very hard with Ministry of Education in order to set up this e-learning system. And the teachers that would provide the training on site need to receive the certificate from e-training course first. And so you can now start to see the first outcome for sustainability under this program. So this is the documents and that we produced during that period, and I was involved in writing a lot of these materials, and there are other units in this in our team who developed these contents which were designed to fit with the children needs from different regions in Thailand, in the north, south, northeast, which may have different style of eating. And this is the pictures of the training to measure the height and the weight of the teachers, because a lot of teachers might not understand fully how to measure height, for example. And these are some game that we use. So this is a game for providing lunch to students according to the guidelines, because the teachers then know the theory part of it. For example, they should know what meal to match with each other. And then, but the important thing is to ask them to go shopping and then buy the ingredients to do the meal prep and cook something that is according to the guideline. But they have to be mindful of the availability of the local products and the budget. So there was one day dedicated to the cooking class so that the food that they cook is not too sweet or too fatty and too oily. And we make sure that, of course, we had to make sure that the food that they cook is also delicious for the children and not using a lot of condiments. And actually, we forbid teachers from using any seasonings, and we forbid them from using any seasoning. And we would determine what can they put in food exactly. So these are some of the contents that we produce, the papers that we publish, and I can send you later. For example, here you can see we teach the importance of foods and meals related to child learning and development. We explain about the learning objectives, methods for teaching. So which is why I explained that everything has gone through a thinking process, and which is similar to the teaching process for university students, but the difficulty level would have to be greatly reduced because this needs to be practical, and this curriculum has been approved and has been published. So this is the outcome of our training. When we reported this, we hadn't reached 200 schools yet. When we published this paper, it was about 109 schools from Central region, 45 schools, North 13, Northeastern 28, and South 23. We also have rural school 20, semi-urban 67, and urban 22 per school. The total participant is 510 people, of which female are 80% in this 510 people. And we have 78 principals, 106 health teachers, nutrition teachers, 154, and 77 cooks and 95 local staff, and everyone received the certificates. Now, before we conduct the training, if you look at the pre-test, we divide the outcome into different topics. For example, child growth development, we have 4 points. School lunch guideline, 10 points. School lunch planning, 9 points. Food choices, 3 points. Food exchange, 4 points. Total score is 30 points. So the total score during the pre-test would be about 16, which is not satisfactory for us yet, because I set the score to 80 to 100%, but after they received the training, the score has increased, from 16, it improved to 22, which is better. So that is a little quite encouraging for us. So because you see that some of the score on some of these questions where they don't have prior knowledge, they improve a lot, especially for like guidelines, especially nutritional guideline. from 4, you see that it jumped to 7. So these happen because of the training we provided with that, and we want the teachers to understand the school lunch meal program from different dimension. And this is the pictures of the M&E, or monitoring and evaluation. And so during this M&E process, we look at the actual implementation at the school. For SLP, we want to monitor what are they going to cook for children on Monday and Tuesday, for example. And this is the meals schedule that the teachers develop. And this is not something that we evaluate alone. This is also evaluated by the Ministry of Education, and there are random inspection or random monitoring of Ministry of Education. And this is something that we continue to follow up and monitor at the school that they receive the budget. For example, at the school today, they have fried vegetables and fried rice and pumpkin soup, and dessert they have banana pudding in lemons in coconut milk. And this is the picture of the teachers cooking, and these are the children from the northern in the mountainous area, which came from poor family. So these are the children that received the food from Ajinomoto Foundation. And these are school with the cafeteria or canteen. And if they have proper canteen, they would improve the hygiene outcomes of the school. So these are schools that received about received the funding for building the cafeteria, which is about 1 to 2 million baht per year, per school, sorry. And these are the pictures of the food for children from different grades. And I would take a random inspection of food from different schools to gauge whether the teachers provide proper amount of food to the children. And I also look at the ingredients in the food to determine whether they will receive enough different macro and micronutrients. So you can see that from this data that these are the recommendations of foods and the follow-up numbers after 6 months and 12 months. The recommend one for the rice spoon is 2.5, and you can see that after 6 months it's 2.2, and after 12 months it improved about 2.3. But for the cooked meat, we only recommend 2, but the teacher usually give more to 5.3 tablespoon, and because teachers would normally think more meat is better, or it can be due to the fact that they give the children more when we visit the school. So we try to inform the teachers that these are not something that they should do, because they should follow the guidelines. And we ask the children, in fact, we ask the students, whether this is the food that they receive every day. And the student actually told us that this is the food that they receive when we had guest visit. This is the look of the food that they receive. So of course we know that the amount of food the children were given changed because of our presence, but we did not, discourage the teachers or tell them that what they did is wrong, but we just try to find way to be a little bit diplomatic with them and tell them what is appropriate, what is the right amount that the teacher should give to the students, what is the proper amount, and essentially giving more of kind words, encouraging words, rather than scolding them or say anything that would discourage them, because nobody likes to receive criticism or to be criticized or to say something that is hurtful to them. So we were very careful with our choice of words when we talk to them and to be more supportive and encouraging to them. So this is a system that I think is very important, M&E, because when we visit, we were conscious that we were there to support them, to encourage them. And apart from the SLP from Mahidol University, they also have a very simple software that they use. The Ministry of Education also have the software, but it took a lot of time to process the data. But this software at Mahidol, I believe I have taught some people from Laos, where after you input information in this Excel, you can determine whether the children are having any problem with underweight, stunting, or wasting, or overweight. And the other thing that is important is the food environment, which is something that we work with Australia, which is the International Network for Food and Obesity, Non-Communicable Disease Research Monitoring and Action Support, with professors from Swinburne University, Australia, to observe the environments of food and how that impact the obesity and overweight in children. The objective is to evaluate the quality of school lunch menu by comparing with the Thai RDA and to evaluate the density of school food shop both in and outside the school fence. And we want to understand and support for and barriers to children obesity prevention relating to school environment in Thai. Is it because the food provided at the school is not enough or is not delicious? Why is it that they're buying food from outside? So this is the actual environment of school in Thailand, and I'm not embarrassing to show to you. We're trying to show you that school should not sell these products. Anything that we forbid are still, we can observe that they're still being sold, for example, cutlet drinks or ice cream from different makers and fried sausages. And I was puzzled and perplexed. Why did children buy of this product? Did we not provide enough lunch for the children? So, and this is something that we are doing on a survey basis. And in the middle of this circle is the school, and we have to plot the GPS in this school area to find out the numbers of shops and stalls near the proximity of the school and find if there is any relationship between school the student obesity. So my assumption is that the more shops you have in the school proximity, the more likely that the children will have increase in weight and become obese. So what we find is that the finding is consistent with previous study, is that the density of restaurant, grocery stores, and convenience store did not affect the BMI of school in children, which might be surprising to a lot of you, or the density of food store we have to understand that in our country, it is not possible to differentiate which store is healthy store and which one is unhealthy store. So if you go into the convenience store, you cannot determine that because they sell everything. And because in the methodology, they told us to differentiate the healthy store and unhealthy store. But in Thailand, I told them that it is not possible because this is a part of our cultures that they sell everything, both healthy and unhealthy store in the store. And it is very difficult for us to work in the convenience store and just count the number of healthy and unhealthy food. Because if you do so, they will kick you out from the stores, So there's a lot in the methodologies that they give us, a lot of them do not work with Southeast Asia culture. And what we learned from this study is that if we're going to do this kind of research in the future, we need to have more detail on how to classify healthy and unhealthy diet before we can classify the stores, because there's no such store in Thailand where they sell only healthy foods and only one category of food. So it is very difficult to determine the size and the amount of healthy and unhealthy food, because just by standing in front of the store, they already do not want us to be there. So from this study, what we learned is that the food outlet in and outside of school may have different items sold there. So we have to make sure first, we have to understand first what is healthy and what is not healthy, because we have to understand that first, because we can just not go to the teachers that you cannot sell this and that. We have to listen to their reasons as well and inform them what is healthy and what is not healthy. But if it is necessary for them to sell those items, we encourage them to select some items only, and maybe it can be target towards more affluent children with the buying powers, so that only rich kids can buy. And for this issue, I think Japan did really well, because they forbid the parents from giving money to children to go to school, and they were able to address this problem 100%, because nothing is sold at school and children are not given money to buy anything. And this is the different factors that we have to work with to address issues under this project. We can see that the problem has many factors. If you are interested, I can send you the papers to you. And the strength of this project is that the government may have to pay more attention on unhealthy food in relation to NCDs, and we have to make more study why unhealthy food are so much cheaper compared to healthy food. And maybe we need to receive some support from researchers and teachers as well, because the study cannot just serve the researcher only. It has to serve the people who would need to implement them. And the weakness, of course, most of the school staff lack nutrition knowledge, lack of cooperation in all levels. Because a lot of time when we work individually and separately. And so I believe that the overweight and obesity problem is even more difficult to tackle than underweight children or malnutrition children. And again, all policies are voluntary basis. This is not mandatory. For example, the sale of carbonated drinks, this is not something that we can forbid them from doing so. But what would be good is that not selling them. But a lot of people also argue that if the school is not selling them, then the store and shop outside can still sell them anyway. This is something that is, of course, a concern for Thailand. We also don't have national monitoring and evaluation available policies and program. We also don't have nutritionists and dietitians who monitor diet quality at community level. And we have a lot of people projects that we want to do a lot of health promotion activities, but we don't have the nutritionists to work with us or dietitians to work with us to help us to support this policy. And one more thing that I included as part of this component is the Nutri teachers. We don't have to have this position exactly, people working on this position, but we need somebody to promote nutrition for all types of people at school. So once again, what we learned is that budget is one of the factors, but it's not the most important thing for the success of school lunch program. The first thing a teacher needs to have education. Having money is not enough. We also need to have a system to support and monitor them for long term. and we need to have thinkers, and these thinkers are the Ministry of Education. We also have to be mindful of the workload of the teachers, because teachers have to teach at schools. So we don't want to increase more work for the teachers unnecessarily through the school lunch programs. And the teachers are evaluated by the teaching skill and teaching outcome, not the school lunch program. So in the future, I think we want to have a position for teacher who is responsible for the school lunch program, and then evaluate based on that. And if Lao wants to do school lunch program, I would suggest follow a Thai example, and I already distribute these papers to all of you. And this is the articles when I present the case to the Minister of Education. And I was the only nutritionist in that meeting. And I was very pleased that I was able to use my knowledge to improve the nutritional outcome of my school. But of course, we ran into obstacle, but I did not stop. I haven't stopped. And for the budget, as I mentioned, for school with more than 120 students, they will receive 22 bahts. And if it's under 120, it's about 24, and 1 to 40 students is 36 baht. It depends on the size of the school and the size of the children. It's not 20 baht for everyone. So if it's just 20 baht for everyone in the past, then there's no problem for large school, but for small school, then they would not be able to purchase enough quality food to provide to children, because the funding will definitely be not enough for them. So for sustainability, I don't think of this as the Ministry of Education's project. I think this is a program for Ministry of Health, Ministry of Agriculture, Minister of Interior as well, to make this a sustainable program, because we need agriculture to support us to have nutritious food, and this and so on, because to ensure sustainability, it is not just one party or one ministry responsibility to work on this large and big goals. So thank you for listening. If you have any questions, please feel free to ask. Thank you, Dr. Kitti, for sharing the information that is very useful to us. Any question to Dr. Kitti? Any clarification needed? The floor is yours. My name is Kapasak. I work with within the education sector. What I observe from your presentation when you explain about the preparing of lunch for the students, the food was cooked by teachers, if I heard correctly. And my question, is there no impact towards the teachers teaching, and these teachers who cook the food, are they civil servant or part-time teachers? The teachers who provide, who cook lunch, they have to prepare the meal. Some school, they also cook for it and buy the ingredients. And in some school, they hire locals cook or the parents to cook. It depends on the context of the school. So 20 baht per head is not enough. So they had to hire a cook, which is 300 bahts per day. And if you see the new budget that we developed, yeah, we include the budget for the chef. This is up to the management of the teachers on how to manage that budget on the cooking side. And I calculate that 18 baht, for example, is for meat and other ingredients. And if there is money left, they can buy certain, other ingredients. But usually it's 18 baht is for the ingredients, but 2 baht is for the management, which includes the field and etc. And a lot of schools say that this is not enough, and they want to have one person to have the responsibility on this school lunch program. And we are calling them school lunch teachers, which is just a nickname at this point, but we want to assign the responsibility of cooking and preparing meals to teachers, because if we don't set up the system like this in the future, then it would create the burden for the teachers themselves, because as you said, the teachers have to teach as well, so we need to find a fixed position for teachers. And a lot of time, this is something that a lot of people don't want to do, especially now in this days and age where people use a lot of social network, and you see people taking pictures of their food online and then post it online, but the teachers who cook this food, they cannot do that. It is prohibited. If they do so, they would be arrested. So a lot of time, a lot of the good things that they do go unnoticed. It goes behind closed door and nobody see the deeds that they are doing. That's why a lot of people are really not interested in taking this position, because what their good deeds, are not seen by many, unlike other professions or other jobs. And it is a hard work, because they have to work and cook for children, more than hundreds students for 200 days per year. But then when you evaluate these teachers, the KPI would focus more on whether the learning outcome is good or not based on what food they cook for children. So this is something we need to address. Thank you for the explanation. May I ask one more question? If Laopedia can follow the footsteps of Thailand, and if we have the similar budget, especially the budget to hire cooks, that would be great. But from what I can see in Laopedia, we don't have the budgets for the cooks or the chefs yet. Usually the chefs that we have at school lunch program actually came from the community, and they rotate. And if they rotate, there's a problem on the implementation side. For example, some people who are rotated to different days or different school, they might not have the knowledge, especially nutritional knowledge. They would just follow what they are used to when they cook. And that is a challenge, I believe. And to become the permanent cook, I think I talk with a lot of nutritionists as well, that this is a problem, because when we mobilize the fund, especially from the community, we would not get a large amount of fund. But to have a permanent chef and permanent staff, I think there's a big challenge for us. In Thailand, you have you provide lunch 200 days per year, but in Laos, 170 days per year. And in these 170 days per year in Laos, there's no guaranteeing that these cooks are not going to be sick or ill or and became absent. So I think it would be good for Laos to set up the budget to have a chef or cook for this role in particular. And so thank you very much for sharing with us your experience in Thailand. I think that this problem, I also want to start the school lunch program in Laos by looking at the entire system yet first, but we have to work on finding the budget first. But the thing is, we want to use the lesson from Thailand and apply that to Lao PDR. So there might be some similarities and some differences between the two countries. But the keywords that we need to keep in mind is sustainability. Because if we don't want to run in situations where we run out of bread and there's no more food for children at school, because lunch and milk is important, are important for them, to receive in a day, because they are our future, and we need to ensure that they need and receive the necessary nutrition on a daily basis. But to do this, we need to sit down and discuss about the details, and we need to inform everyone that this everyone's responsibility, and we need to make sure that we'll have to incorporate this school lunch program as part of the education system, so that each year you don't have to go and mobilize the fund. Yes, I have a question. In your project, did you develop any manual or guideline that is a standard operating procedures or SOP for your school? And yes, I did. And can we see this website? Yes, I have on website and hard copy. Actually, sorry, I only have the hard copy. It's in Thai, and I can bring it to you when I visit you. The reason I asked you is that because we have LEAP project in Sranacharoenpong and Khammouon, and they were thinking of developing the SOP for nutrition for SLP, and that would be a good reference for us if you have the SOP in Thailand, so we can adjust to allow. Yes, I'll try to find a copy and send it to you. And I saw Dr. Sumpon raise hand. Yes, thank you, Professor Kitti. Thank you. This is a very interesting presentation, and this is something that I've learned from you. And in the future, we would have the project similar to this, but for my project, it's about food fortification, especially rice fortification. Do you have any experience about food fortification? Because I want some guidelines, including the evaluation as well. Thank you. What vitamin do you want to put in rice? What vitamin? 8 types of vitamin. There are vitamin A, B, complex, zinc, and folic acid. For us, it is sticky rice. In Thailand, we don't do this, but my colleagues, what they did is they put iron in rice and give it to children, and we monitor and evaluate. But they have the period for that, usually 3 months to 6 months. And they also do this at school. But one thing we have to understand is we have to understand the behavior of the cooks. And we have to tell them that they don't need to clean the rice, but a lot of time they will clean it because they are used to cleaning rice. So at the beginning of this study is that they did not get the iron that they need, but once they stop washing it, they can, they get more iron. But the question is that, is there anything we can put it in the food for children so that they can receive iron? Because when we put some nutrients in food, and in long term they do not reject it. For example, in instant noodle, children also, when we follow up, we ask them if they are interested in eating the instant noodles. At first they eat them, but then after a month they cannot eat them anymore because to see the result, you have to eat it every day, so after a month, they all shunned the instant noodles. So we are working on a similar projects for children where they have to eat certain group of food for a long time. Especially now we are doing the eggs consumption in children. So we are studying whether if children receive eggs on a daily basis, that would increase their height or not. And if you're interested, but this is something that you need to monitor in a certain period, and you need to start small, in a small scale, do a pilot project. And in Thailand, there has been some success studies on this. For example, the food fortification project where they include vitamin A and iron, and they saw some success in this and to reduce the micronutrient under the problem of the lack micronutrients in food in children. If you are interested, I can send you some of these studies. We had a lot of success and a lot of lesson learned from this, because in the past Thai also tried to incorporate vitamins and minerals into the drinks, but when the children drank these drinks, they could not drink them because the taste changed due to the addition of these micronutrients. So we have changed the way how we fortify this food. So instead of putting in drinks, we put them in food. Dr. Kangen, UNICEF. Good morning, Kangen from UNICEF here. Thank you very much for sharing your experience. And I say that there are many things that are very interesting where Lao can learn from you. I'm interested in 2 or 3 things where I want you to explain or suggest. First one relate to the previous point about the SOP for school lunch program, and this is something that a lot of people has been asking on what kind of standards we have for school lunch program. And because a lot of stakeholders are asking whether the investment in the school lunch program would be worth the investment, and if there is any standards or anything to support that. So I see from your presentation that in Thailand you are very advanced, but do you run into any obstacles during the implementation? I imagine that it would be very difficult and it quite challenging because from my experience, I see some school when they're doing the school lunch meal program, they could not, follow the guidelines every day. So I can say, I think that if we are going to develop a standard for the entire country, what is something that we need to consider? Because developing a guideline or SOP is not going to be difficult, I think, but the implementation part of it would be the most challenging part. And the second point is related to the follow-up or monitoring. I saw on some of your last slide, you have to monitor the result of this outcome, and in Thailand, do you have how frequent do you monitor and evaluate? If you cannot do that on a regular basis, is there any way for us to spot check on, or random check this to ensure the quality is maintained? And lastly, this might not be related to a school lunch program. I want to know if Thailand has any indicators, nutritional indicators that are also monitored by the education sector, because in Laos we are considering developing the nutrition indicators that would be monitored by the education sector as well. Let's go to the first question. I work with Lao team for a while now, and especially for Lao school lunch program, I think there are many stakeholders involved, but the problem is whether it's going to be sustainable. So I think the methodologies you can learn from Thailand or Japan, but you have to adapt it to Lao context. You know that in your country, a lot of times children go back to their home to eat. So is it possible to ask them to bring lunch to school and eat at school, or come to eat at school? So in Thailand, I suggest that we, for example, we had 2 side dish and 1 fruits, a portion of fruit. So in Lao, you can do it with just, with maybe 1 side dish and a portion of fruit if it's possible. And so you start with something, you don't have to start big, but you can start small and then you can keep improving. But you should not aiming to have everything in place and all problems are solved before you start. Then you cannot start anything. You have to start from where you are, and then keep improving on that. And if you have the chance to visit Thailand, I can show you that budget is not the most important thing in this program. The budget, it was created by the Ministry of Education, but the budget is now transferred to the local authority, which are then managed by the Ministry of Home Affairs. And in terms, and for the second question for M&E, rather than sending someone to monitor them on a regular basis, we can assign someone to have a position to monitor the food at the school, to take a photo of food on a daily basis to the authority to check, and if they are not following the guideline, then we will cut the budget for that school, because the Ministry of Education will transfer the funding for the school lunch program to the local authority. The local authority has the responsibility to send the funding to the school and then monitor, make sure that, they comply by the standard or guideline, and they also need to send the nutritional outcome result, for example, nutritional outcomes such as the height, the weight of the students, whether there has been any improvement in that. But of course, we also need to be mindful of supporting them, but not increasing the workload for them too much. So it is important for us to know that we need to be more supportive and to create an environment that is more encouraging to them rather than criticizing them. So it is important for us in the early stages to conduct M&E and monitor what is happening on the ground before we can leave it to them to do it. So that's why I said nutritionists need to be available at, at the school or local area so that they can work with the community directly. You can not send. So it is more sustainable than sending nutritionists to visit the school, in a certain period. But we need to develop the nutritionists at the schools. So as I mentioned earlier on, there are many challenges in the school lunch program and in the health sector in particular. But there are many experiences in Thai where you can use and apply in Laopedia, but the idea is not to increase the workload for the teachers too much, but and we need to also teach the teachers to take pictures of the meal that they create that day to the agency to check whether the food that they cook follow the guidelines or not. Next question, Mr. Sangkum, and then Gate Money. First of all, thank you for the presentation. I apologize, I did not attend the workshop from the beginning. It's not a question per se, but to share my experience and ask for your feedbacks or recommendations. Our program is slightly different from your Thailand. We provide more of resources for the school gardens. For example, the seeds or the fences for the school garden. The idea is to produce vegetables and use the vegetable to create lunch or meal at school. So I would like to know what can we do to make sure that this program is sustainable for the school lunch meal program in Laos, because at the moment the parents are not so interested in this program, and as you mentioned in your presentation that this is not something that the health sector or education sector can work alone. We have to work with other sectors such as agriculture as well. So what can we do to make sure that this is sustainable? In some area in Laos, you start with agriculture, right? So the first thing you have to do is the engagement with the community. We have to explain to them why children need to eat, food in different groups, and the parents also need to understand as well. But there's one teacher who asked previously about the chef. In the past in Thai, we asked the parents to volunteer to cook at school, to be the volunteer workers at the school. So we try to encourage them and telling them that what they're doing would be, doing the good deeds, kind deeds for society. And we also encourage people to donate, some rice or ingredients, to the school in order to make sure that that the program is sustainable. That's why I said that budget may be the last factor, So it's not that if you don't have the budget, you cannot do it. You have to first start with the goal in mind, the intention, and then we so for good nutrition, I always say inform the parents or the children that that this the food that they should be eating on a daily basis to make sure that they're healthy. But they can start from anywhere they want, so that they can, basically get the first foot in the door, so they start somewhere. And in the community that we work with, we ask any agencies or organization if they can contribute to this program or not. For example, donate certain amount of rice, or we can work with, agriculture sector to teach students to grow rice. So if one day, if they decide not to continue their study and they have to be dependent on themselves, they can at least become a farmer because of what they learn on how to grow rice during this school lunch program. So it is possible. So like I mentioned, if we are going to wait for the school budget, yeah, we can wait, but we don't know when the budget is going to come. So I want the government of Laos to see the importance of children. And if you're going to start a school lunch program, you have to promise, you make a commitment and tell people on how to make this sustainable. Because if you are going to wait for NGO to help, so what happens if the support stop? They have nothing to eat. Yeah. Dr. Ketmani, this would be the last question because we're running out of time. Yes, good morning, Ketmani from the Public Health Institution. Thank you very much for sharing your experience. I have a question and interest in learning about the evaluation, especially the pre-test and post-test with students, especially for the nutrition knowledge. Which team did you use for the pre and post test? Are these what is done by your team at the university, and how do you allocate the budget for the pre-test and post-test? We are also interested in doing this, but we don't have the budget. And secondly, I want to ask about the nutritionists. You said that you should have more nutritionists at the community. So I want some clarification. What level of nutritionists are these nutritionists at the district hospital or provincial hospital? Are these volunteers? The first part of your question, the pre-test and post-test, like I mentioned, before we have e-learning, it's not mandatory, it's voluntary based, and but only those who learn will benefit. So those who learn or take the e-learning are people from Ministry of Education, and it would be more sustainable if the people take this course on their own, and it will benefit them. And the budget that we received came from the e-learning course. Usually the teachers or people who took this course are those who want to improve their career to get promotion. And so after they graduate from the e-courses, they can now take the on-site training. And it doesn't take a lot to provide e-learning courses because it's essentially just transfer the courses that you have offline into online. So basically, we teach people what teachers know to be aware of about school lunch program and put them online. And what is your second question again? The nutritionist at the community level. Actually, I think these nutritionists should be at the hospital, but these nutritionists need to work with the community. You can have one nutritionist at the school, but nutritionist at not at the school, not at the hospital, but the nutritionist at the school and hospital, they would work differently because one would focus more on the patients, but one would focus more on the health of students. And they have to be divided, but they can both belong to a hospital. But in Thailand, we have nutritionists only for the hospital, but we don't have the nutritionist for the community. There's actually no position, but those who work on this are actually nurses, but they are not really educated from in this field, so they might not know everything. So we need to have something that is quite concrete. For this, I want you to learn from Japan. Japan is a country that has more records for over 100 years, where you see the increase in the height because the government invests in school lunch program and milk and for the past 100 years, and they have a lot of success. I think Sanya want to ask something. Just one last thing. I actually have prepared 4 or 5 questions, but I received some answer from other questions. When we first start the SLP, we want to make sure that they have food and milk. Is there any replacement for milk, especially cow milk? For milk, I think this is a good source of calcium. But there are other sources of good calcium from other food, but I'm not sure if we can give it to children and can achieve the same outcome. For children from 3 to 12 years of age, they can do powder milk. The powder milk is about, the cost is about 5 baht per bottle. And the teachers has one responsibility before the school start, just boil water and put the powder milk into boiled water and give it to all students before they start the class. And there would be no waste from that, plastic bag or anything. And then you can provide powder milk. But if you want to replace it with, small fish, yeah, of course, small fish has calcium, but not all children want to eat it, and it's salty. And a lot of kids in that area, they do not like to drink or have breakfast. So, but if you provide them with milk in the morning, then they can start off with some milk, or if you know that some children, if they go back to their house, they will not have any food to eat, then you give them milk to drink before they go back. And for milk powder, I don't know if you receive them from any INGO. If you receive them, you can use milk powder instead of cow powder, cow milk, sorry. And then Ministry of Agriculture can then, come up with plan on how to develop a locally produced cow milk. Ladies and gentlemen, we have now come to the end of our workshop today. On behalf of the Nutrition Center, I apologize that the head of the Nutrition Center had to join another meeting now. So I would like to thank Dr. Kitti Sranacharoenpong for sharing your experience with us and for giving us a lot of wonderful ideas on how to apply this to Lao PDR, because at the moment, Lao is also working on improving the efficiency, effectiveness of school lunch meal program. And thank you everyone for your interest and for joining with our workshop today. I look forward to meeting with all of you again in the next topic. So thank you everyone for joining us today. And all of these are being recorded and we would post them on YouTube. And so if you are interested in watching this again, you can re-watch them on YouTube. And due to the time limits today, we could not ask any question to you. So please don't get tired of receiving questions from us. We would send you questions after this and we would meet with you in February again soon. So we look forward to meeting with you in person to increase the capacity for our staff. So we have now come to the end for today's session. So once again, thank you to Dr. Kitti Sranacharoenpong. No, it's not a problem at all. I also look forward to work with you, and I am more than pleased to work and support you. And I want to make sure that what I've gained over the years can be used for something useful for not just Thailand but for Laos as well. Because the question lastly, the last question from Sanya, he worked with a lot of INGO. I think he has a lot of questions to ask you, maybe offline. Thank you very much and Happy New Year once again. See you next time. Bye bye. Goodbye.